You guys can either put your table here, or you can put it over here and go side to side here. But I'm gonna put it here so that all of you guys can see, okay? So the first thing you guys are gonna do is you're going to position your patient. So whichever way you guys are gonna irrigate, so if they have a butt wound, you'll probably wanna turn them on their side, okay? If they have an abdomen wound, you might wanna sit them up so that it'll drain out. So for this case, we're gonna pretend like this is an abdomen wound, and we're gonna sit them up a little bit. Maybe.
While she's doing the bed, quick question. Can we do sterile technique on a cable that hasn't been cleaned off?
No.
Waist high, clean and dry, right?
So wipe it off with the bleach. Okay, so you guys are gonna put your Chucks pad down below so that it'll catch your drainage. You don't want it going all over your bed and your patient being saturated and them being pretty irritated because they're wet, right? No one likes being wet and sticky. So put it here, line them up. Then you guys are going to put on gloves. Tracy, it's weird because I can't even see you,
I know.
but I can hear you. So you guys are gonna start taking off your dressing. You're gonna peel it off kind of nicely. You don't want to tear up the skin. So I know this is a mannequin, but I don't want to see you guys be ripping this off. So support the underlying skin. Take it off. You zooming in on me?
No, it's just my eyesight is bad, so I had to clarify. I'm here, make sure I'm
Okay.
seeing it.
When you guys take it off, you're gonna look for coca. So color, odor, consistency, and amount. Okay? Remember that. Coca, coca, coca. And make sure when you guys are doing your checkoffs, you don't just say coca. Because when I first started here and I was doing wet to dry checkoffs, a student goes, oh, I'm gonna check for coca. And I'm like, what? And then they didn't know what it meant. So you gotta know what it means. Right? Color, odor, consistency, and amount. Then you guys are gonna fold it up. And if you have a biohazard bag, you can put it in the biohazard bag. But I'm gonna put them in the trash. Because then I'm gonna take the trash out and put it in a biohazard box. Because a lot of places you won't have biohazard bags readily available. Okay, now here's where one Q-tip comes in handy. Tracy, will you grab me a measuring device too so I don't have to pull it out? So you're gonna take one of these. You can take the scratchy end because it kind of gets a hold of it. And you're gonna pull these out. And you wanna make sure that it's just one instead of 5 rolled up into each other. And you're gonna count and look at the coca of this. So this is 1. 2 coca. 3 coca. And some facilities, some nurses will say, get this wet before you take it out. That defeats the whole purpose. Because the purpose is to debride all the bad tissue. So if you get it wet, you just loosened it up and you just left all the bad tissue in there, okay? So don't get it wet, it's supposed to pull out, it might bleed a little bit with it. So then you take your other one, 4 coca. The important part of counting is to remember how many you took out because that's about how many you'll put in, depending on if it's healing or getting worse. So if it's getting worse, you might need to put 5 or 6 in. If it's healing, you might need 2 or 3. Okay?
I was just gonna add also, note how many were put in, make sure you get them all out,
Yeah.
because that's an infection you're not gonna want.
Right. So then you guys can pitch this one. So I'm gonna hold this up so you guys can see it. So you guys, what is this? Flat here, eschar. And what is this part in the middle here?
Bone.
Bone. And what is this? The yellowish
Where is the schema?
slough.
Slough.
Okay. So if it has any eschar on it, can you stage your wound?
No.
Okay, so it would be unstageable. In the bottom here, can you guys see that? That pokes up? That's tunneling. Everyone see that? And then can you see up under here where you can kind of grip it? What's that called? Undermining. Okay? So, and it's kind of like a boggy field. That's how you can kind of tell if it's undermining or not. Okay? I'm going to put this back down.
What's the pink?
Yeah, what's the pink reddish tissue?
Granulated.
Which is good tissue, right? Okay. So now you guys are going to take your next Q-tip and your measuring device. So measure before you clean because you're touching. So if you clean it and then measure, you've just ruined your cleaning, right? So you guys are gonna measure in centimeters, and you're gonna measure from the widest part, longest part, and deepest part. But then you also have to measure the tunneling and the undermining. So we'll go with widest first. So let's see here. About 7.6. And just kind of move it around, find the widest point. About 7.6 centimeters. Okay? You guys got to remember these because you'll have to record them. And the longest part is about 9.8. That one's 10.4 centimeters. And then for the depth, you guys are going to use your soft end and stick it in the deepest spot and kind of line it up with your surface area and then measure this way. So about 2.3 centimeters. And you guys can do your tunneling same way. Stick your cotton tip applicator in here. Measure it. 3.5 centimeters. And then your undermining. You're going to measure the same way. So find your deepest part of your undermining. So this would be the deepest over here. And measure about 3.1 centimeters.
How are you remembering all this?
You can have someone write it down, or you can take your hand and write it down on a piece of paper. A paper towel works really well for remembering documentation. Nurses do it all the time. It's your best friend, okay? So you can have a marker or whatever. Just remember you're dirty, so you don't want to retouch everything back and forth, back and forth. The big thing with this is, once you guys have measured it, you need to remember how to document this. So think of this as a clock. This is noon, midnight. This is 6. So at what o'clock would your tunneling be?
7.
7. And your tunneling or undermining that starts here and goes to here would be what time to what time?
10 to 2.
10 to 2, roughly. Okay? So that's how you would document it. Your undermining is 3 point whatever centimeters, and it goes from 10 to 2 on the clock. And your tunneling is at 7 o'clock, 3.4 centimeters. You guys got that? You got the measuring. So then you guys would pitch these, right? Pitch, pitch, pitch. Set it back here. And change your gloves. You now messed with the wound, you're dirty, etc. Change your gloves. And every time you change your gloves, you should do what?
Wash
your hands. Okay? Then we're going to get our irrigation kit ready. So you will need your saline. So these are your little saline containers that you will use for lab. What do you need to check on it? Okay. So expiration date. You also need to see when it was last opened. So saline is good for how many hours? 24. So if it's been opened, say it was opened 5 hours ago, what do you need to do to it? So you're going to take the cap off, and you kind of roll the saline around the edge to lip it, so it rinses off all the dirty particles. Okay? If you set your cap down, make sure it's up. So you don't want to do this, it's contaminated. Okay? You will not actually open these and use any water in lab. Okay? So, pretend. Now we're going to open our irrigation kit. So we checked expiration date and integrity, and irrigation is clean, so you guys know, okay? And you guys are gonna reach in and grab out your irrigation, right? And you guys are gonna pour your saline in. So you're gonna take it out, pour your saline in, put it back down. So now you guys should probably put new gloves back on. I didn't take my allergy meds yesterday. I'm paying for it, kind of like you did with Luca. So, on the syringe here, you cannot touch this spot because it goes in your saline. So if you touch this, you contaminated your saline. Okay? So you want to hold it here in this little lip. Everyone see that? So when you go to do it, pull it up, and then you're going to hold it here. As you guys irrigate, you want to irrigate from top to bottom or cleanest to dirtiest. So we're going to go top to bottom. You want to hold it a couple inches above the wound, and you want to make sure that all that you put in is coming out. So obviously with this wound, with the tunneling down here, it would catch there. So you would want to turn them on their side so that it would go out. But I'm going to irrigate like this so you guys can see it. Okay? So you guys want to go like this, slow and steady, clean, clean, clean. So say you use all of it and you only did half your wound. You can go back into here, as long as you have not touched your syringe, and pull up more. How many mLs does this syringe have? 60. So if you use 2 or 3 syringes, you need to remember how much you irrigated with, because you're going to document this later. So I used 2, so how many is 2 syringes? 120 of saline. So that's how much you irrigated with. And like I said, you need to make sure that it all comes out. If it's not coming out, you probably have another tunneling or undermining somewhere. Okay? So then this can go back in here. And I suggest you guys play with this a little bit because sometimes they stick. So loosen it up because otherwise you're going to be like pulling it out, or you're going to go to irrigate and you're like, whew, and you give it all at once. Okay?
You
So
jam it
controlled, slow, 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 slow. Okay? Don't touch this to anything. Got it? Okay. So that is irrigating. Now, there's not. There should be a gauze in here, but there's not in this. This is where you need to add gauze to your thing. And you would take it and blot dry your edges. Okay? Then you take your gloves off. And I want to see all of you taking your gloves off the proper way. And move this out of your way because you're going to need your whole table. So set it over here. Now here's sterile technique where you guys forget important parts. So remember how I taught you about sterile and how to lay down drapes? This is where it applies. So you wash your hands. You're going to open your kit. And on top is your gloves. So you can grab those. What I'm going to tell you is this drape is really large. So you probably will not have room on your table to do your gloves. So you can make room at the edge of their feet to do it. So I'm going to set them here for now. Then let's see here. You're going to grab your drape. What's your border you're allowed to touch?
1 inch.
Okay. And which side goes down? Dark blue or light blue?
Dark blue.
Dark blue. So remember you guys do this and set it down. And this is actually a shorter drape than it usually is. It usually takes the whole table. So shorter drape, you guys can make it fit. If it's longer, just make sure you have all your stuff moved out of the way, including your saline. Okay? So now you guys are going to take your kit and you're going to dump it on your drape. So I don't want to see you guys doing this. Okay? Because you contaminated, remember? So what do you guys need to do? Kind of hover. Put all this back in here. Okay, so kind of hover, dip slowly, because sometimes it has tape in it too, so it'll go rolling across the table. So if you do it slow and steady, it'll kind of drop, okay? And you guys are going to move your tray over here.
Notice you hold on to the paper she peeled back so it doesn't hit the drape.
Yeah. And you want your saline. So can I do this?
No.
Okay, good. You guys remember me teaching you. So you're going to pour it in your containers. Okay, all 3 of them, 1 of them, whatever you want to use. You can do just one, and you're going to set it to the side. But don't reach across your drape. So go behind it and set it over here. Okay? Then you guys are going to find your gloves. So I'm going to move this out for a second. And you're going to put your gloves on. So these ones are folded actually backwards, but okay, we're gonna grab it. What did I tell you? Step back, hold it up, put your gloves on, and I know I would contaminate because I'm below my waist, but pretend it's up. Make sure you guys aren't touching anything when you put your gloves on. Okay. Good. Leave that there. It's not causing any harm. You don't need to elbow it out of the way, throw it on the floor or anything. Your feet become your best friend because now you can move your table back, okay? And you guys are going to take your gauze. So I'm going to put like 4 or 5 in here. 2, 3, 4.
Yeah, that's actually solution right there.
That should be wet. Okay,
Okay.
so this is going to go in
That's what I would make sure.
moist, okay?
So it has to be moist.
And then you guys are going to set your other gauze over here.
So technically you're reaching over it though.
Yeah.
How did I do that?
I just feel like that.
I mean, you gotta reach somewhat, but you shouldn't be reaching all the way across like this. So
Oh,
you gotta
but-
reach into your field a little bit.
Oh,
Okay.
okay.
So make sure everything's away from your 1-inch border, okay? And you're obviously not gonna use this. So the kit comes with it in it. Obviously you would have wanted it before you ever did it. So if you guys wanna use the one in your kit, make sure you pull it out. Okay, So now we're gonna start packing. So, you're gonna grab your gauze, and you're going to stretch it out, and then wring it out. And you're going to take your cotton tip applicator, and what I do is I kind of hold it in my hand to contain it so it's not all loose and everything. You're gonna start from the deepest part, tunneling and undermining. So I'm gonna do my undermining first, and you guys are gonna pack. And you want it to be packed but not super tight, because if you do it tight, it's gonna make the wound even bigger. You don't want to touch the outside edges. So then you're gonna grab your next one.
You really don't want your glove touching the wound at all.
Right. Did I touch?
No, but it's hard to see from this side whether you did, so I'm pointing it out to them.
So stretch it out, kind of bunch it back up in your hands so you guys can contain it. And then I'm gonna do my tunneling here. Okay? And you just keep doing this until it's full. So what is full? Where should the gauze be?
Level to the
Level. Because if it's kind of piling over, you're gonna put pressure on it when you put your ABD pad on. So squeeze it out, contain. You can pack your wound here. I understand that this is dry, and sometimes it might flap a little bit, but I want you guys to mention that it should not touch the wound edges. If you do it controlled, like I'm showing you, it won't touch the wound edges a ton, okay? So don't be trying to do it sloppy. Go slow enough that you guys can control it.
So if we do say it, will be count as a correction?
As long as you don't do it a bunch,
Okay.
okay? So control, stick it in.
Yeah, it's
And
like
it's harder with a dry cotton swab and a dry gauze to put it in than a real one, which is why she's trying to
Okay,
stick
so
it
is that full?
No.
looks full.
No. You could probably get at least one more in there. So keep stretching these out, bring them out. Okay, so good point. What are you supposed to be doing? Counting, right? Okay, so that was 4. So this one I probably want to scoot over a little bit so you can fit this one in here. It's not going to be perfect. I know it's dry. So now is that better?
Yeah.
It's better. Okay. So you could probably get, if it was wet, you could probably get another one in there because it'll stick a little bit more. At this point, you're going to pitch this. So don't be doing this and dropping below. So you can either drop from your waist or set it over here, and you just have to clean your table. Okay? At this point, you guys will take 2 gauze. So take one like this, kind of hold it so you don't touch anything. Put it on top.
This one should not be moist.
These should be dry. Okay? And they kind of line the wound like that. And you guys will take your ABD pad. So there's a blue line on it. What does the blue line mean? Blue line is just an indicator line. It shows you which side goes up. It can also show some moisture. Okay? So put it down, covering your wound here. And then you guys are going to tape.
So from this point, you can do that.
I mean, I would keep your gloves on. You guys need to learn how to tape with gloves on. So you can either kind of estimate it, which I am good at, and you can set this back on your table. And you want to do a whole window. So every edge needs to be sealed. Every little groove. So when you go through the butt, sometimes they won't have you tape down here, but we're going to tape it. What else do you need to do with dressings?
Date,
Date,
initial.
time, and initial it. So your last piece of tape that you do, you could take your pen and write on it, and then just stick it on a corner.
So he asked about, does the top piece of gauze need to be dry? What would happen if you put moist gauze on top of healthy skin?
Pressure with skin
Breaks
pressure.
it down.
What's that word when it gets all moist and
It's gonna cause skin.
Maceration. So it
maceration.
damages the healthy skin.
I want
So
some mess.
write your name, your initials, the time, and put it on the corner. Okay? Write on the tape, not on your person.
Okay.
Okay?
Right on it before you put it on their body, because
Yeah.
nobody wants pressure on their wound while you're
Yeah.
trying to write it.
That's what I was gonna
Okay.
ask.
At this point, what do you guys need to do?
clean it up.
Clean it up. So you're gonna clean all this up, which I will in a second. But what affects wound healing?
Nutrition.
Okay, so high blood sugars.
Oh.
What else? Poor nutrition. Okay, stress. Good. So you guys need to know those three: stress, poor nutrition, glucose. Okay?
Not the age of the person.
I mean that too, but I want you to know those three.
Oh, those
Okay.
three.
There's way more than that.
Right.
What is it?
Those are
That's
the
why I was
three
gonna
highlights.
roll it off.
Okay.
What were the three again? Stress, poor nutrition,
Glucose.
I thought
Okay.
What about pressure?
When you
So
guys
stress.
are cleaning up, you guys need to kind of wrap it all into each other. That way you're not having a mess and you guys can throw it in the trash.
And you take your gloves off and put them inside of there.
And, yep, and throw it in the trash. Okay? Make sure all this goes in the trash. Clean up your gloves packaging. A lot of nurses will leave these.
And
Okay?
poor nutrition.
Throw them away. So what do you guys do after you clean up?
put the patient back to normal.
So before you do that,
Position the patient away from the wound.
okay? So position them how they want to. What else do you need to do?
Wash your hands.
Wash your hands. What else?
Clean the table.
Okay, you clean
Assess
the
their
table.
pain level.
Documentation.
Pain. Good. What else?
Educate them. See how they
Educate.
tolerate
So what are you gonna educate them on?
Use the call light. I don't know.
What do they need to call you for?
If the drainage is bad.
So if the dressing comes off, if it's saturated, what else?
Signs and symptoms of infection.
Signs and symptoms of infection. So fever, pain, and chills. What else? If you have an abdominal wound, what do you need to do? Splint. So
Oh,
put a
pillow.
pillow over it. Anytime they cough, sneeze, they need to splint that wound so it doesn't split. Okay? So then, right, yeah. I have seen a guy's, he had a surgical incision, and he went to cough and it spewed open. So, make sure they know to splint. So put some pressure on it, hold it together while you're coughing, sneezing. Okay? Then you guys are gonna do what?
Lower the body.
Okay, put your side drill up. Give them the call light, give them their table.
Wash
Remember,
the
this
table off.
has everything they ever own on it. Their urinals, their magazines, their phone, okay? That's why you have to wipe it off too, because the guys, they set their urinal right on their tray table. Okay? So make sure you wipe it off before you use it. So what are you guys gonna document?
Everything.
Not everything. Date, time, procedure.
The measurements.
So start with irrigation. So start way back at the beginning. What do we do that's documentable?
The
I don't know if
measurements.
it's a word or not.
Do your procedure.
Wound measurements, okay?
How much you irrigate it with.
The coca, the dressing,
Color and how many.
how many you took out, okay? What
How
else?
many you put in.
Weight on that one.
How
So
much
what else?
water? How much saline?
How much saline you irrigated with, good, okay? Now go to your actual dressing. How much you packed, okay? How they tolerated it, their pain level before and after. If you gave them medication, how long do you need to wait? 30 minutes. Okay. Then you need to document something about safety and stable. So patient in lowest position, side rails up, call light within reach. Patient left with no acute distress noted at this time. Don't put will continue to monitor. I'm sure you guys have seen that in facilities because then you gotta go back and make extra notes, okay? Which you will monitor them, but don't put that in a note, okay? Questions on this? You guys got it? You at least
Yeah.
remembered all your sterile technique. That's half the battle. Okay?
Would you like me to tell you the common mistakes I